Hello, friends. I'm Dr. Shanta Kumari, President Foxy and Treasurer Figo. In this episode of Diamonds Are Forever, we introduce you to the person who invented the concept of a hydrostatic balloon tamponade to control postpartum hemorrhage in a case of uterine atony. Dr. K. Shivkar was born on the 27th August 1943 in Bombay and had his medical education there. He invented the concept of hydrostatic pressure to control atonic PPH. Let's trace his journey on how he got the idea and how he refined it. After some resistance, his idea of hydrostatic pressure to control atonic PPH has now found acceptance world over. Let's meet Dr. Shivkar in this episode and listen to the legend himself.
Friends, today I bring you the person himself. The diamond which we have today is Dr. Shivkar. And today I am with Dr. Shivkar as his residence to ask him a couple of questions about the Shivkar's pack. So good evening and welcome to this show of Diamonds Are Forever from ICOG. A very, very warm welcome from Foxy and ICOG to you. And we are making this small series on highlighting the Indian contribution to the subject of obstetrics and gynecology. And I feel this hydrostatic pressure balloon to control postpartum hemorrhage is one of the very important discoveries of our times to save lives, and you are the person who has invented it. So, sir, tell us a little bit about how you thought of it, how the idea came to you. And let me tell you, sir was in the JJ group of hospitals for a very long time. He's been there, and that is where his story starts from. Over to Dr. Shivkar.
In early 1980, Dr. Kusum Zaveri brought one case from her private to JJ hospital for PPH. The case was bleeding, and this bleeding was stopping every time when uterotonics were used. But after 10 minutes, uterus again used to relax and bleed profusely. So she took decision of packing. I assisted her and saw the way she was packing the uterus. I saw the propping up the uterus through lax abdomen whenever she used to push the pack along with uterine packer. She packed very nicely, successfully, and bleeding stopped. I realized properly done traditional pack can be useful thing. But again I started thinking where to get Kusum Javeri like skilled person if such bleeding occurs in remote places. So I decided to simplify it because pressure given during packing is all subjective. There was no measure for it. So I started going through literature and found a lot of interesting things in the literature, like how many packs were maximally used, uterine packing machines. Packing machines had a claim that they can pack the uterus within 5 minutes with proper pressure. But also there were comments, because uterovaginal packing was not done frequently, doctors were not trained to use the packing machine. So packing machine remained unused, rusted, broken. When the time it was required, the machine was out of order. So there has to be something good which can be used all the time. Yes, for stopping blood in bleeding vessels, some pressure has to be applied. But uterovaginal canal is irregular and those bleeders are not easily accessible. By using hydrostatic pressure, the idea used in O. Sullivan's correction of uterine inversion stimulated me, where fluid can go everywhere, vagina, uterus, cervix, whatever it finds, it will go away. But direct application of fluid to such bleeder is not useful. Some kind of membrane has to be kept in between fluid and the bleeder or tissue, so that inadvertent infusion of fluid will not be there. So I started searching for what can be placed in between the bleeders and fluid. Lot of balloons were examined. During those days, large balloons were available at Chowpatty. I rejected it because they were too large, and if wetted, they used to shed colors. Second thought came plastic bags. Yes, plastic bags were impressive, but not so easily available, and they were wide variety. If I use a plastic bag, stop hemorrhage, but for teaching purpose, I wanted some uniformity. So uniformity I cannot provide with plastic bags. Whereas condom, it came to my mind. The most easily inflatable balloon in the world, I think so. And it is the maximally manufactured balloon in the world. And third, family planning had made this condom available everywhere, universally available. This uterine packing actually was done after 1984. And Kusum Jhaveri had brought this case in 1980. From 80 to 81 was thinking period and collecting literature information.
Yeah.
And in 1981 end, I was ready with the design of condom, IV set and IV fluid, but I did not use it. I used to do experiments in oral hostel where friends used to laugh at me and tell me he did not get chance to play during childhood, so he is doing now.
But the idea had clicked in you, and you knew it will work, and you wanted to refine it and bring it on so that it can be used in patients.
Yes.
So first you used it in the cancer cervix patients.
In 81, I had done for stopping cervical hemorrhages, post-quaternary hemorrhages in the gynae ward. And nurses used to call Shivkar's vaginal trip.
Vaginal trip, yeah.
But it was intended to just check whether it works and whether the patient is comfortable during this procedure. The patient remained comfortable.
So the first time after using it in several patients of cancer cervix and seeing it's effective, when did you get the first chance to use it on a postpartum case?
This was in late 1984, November 2nd week.
How do you remember it so accurately?
That time my wife had undergone cesarean section and was admitted at JJ Hospital, and I was all around there that time.
That's why, okay, but that's great,
Their
sir.
residents called me and told the coagulation failure accidental hemorrhage case has delivered and she is bleeding profusely. They are packed, but it seems the pack is failure. So I communicated to our unit head, Dr. B.J. Wadia. Pack had failed and coagulation failure case is bleeding. He advised repack, no surgery.
Okay.
Now I had a problem. Repack means what? So I decided to use it. Up till now, I had not used condom balloon inside the uterus. Till now, condom was going only in vagina, had not traveled upward. Today, I had decided to give condom chance to go into the uterus. So I asked staff nurse, get me a condom. Perhaps that staff knew what I am going to do. So she shouted, I am going to get it. I told one of the residents, I think it was Dr. Shetty, note the time. I wanted to know how much time it is going to take, because packing machine had boasted they can finish packing in 5 minutes. I wanted to check with it. Within a minute, condom came in my hand, assembled it immediately because I had assembled it before several times, so there was no problem.
In assembling it.
And inflated it up to 60 centimeter pressure with full bleeding stopped. I asked Shakti, what was the time? It is less than 5 minutes. Very good. I was impressed. In the morning, I removed it, found it was intact. It was not ruptured as Dr. Rajiv Korde thought. Then Dr. Wadia came in the morning. I told him I had done this. He was very happy. Yes, you have done something good. I thought I will get firing for using condom inside the uterus. But he appreciated it. Very good. And he told me, we will present this in this month's clinical meeting so that everyone of Grant Medical College will come to know about it. So I presented. Everybody had attended this meeting. Dr. Pale from St. George's Hospital, Kama Hospital attended, JJ Full Hospital attended. And they told me, you have to do more cases because in 1985, All India Congress is going to be held in Mumbai. So be prepared for that. Okay, alone I can't collect a lot of cases. So you will have to supply me cases from St. George's Hospital, Kama Hospital, and I will collect cases from JJ Hospital. Meanwhile, Dr. Ramesh Kothare had come and to meet me. I told him, this is a thing which you used to think monkey tricks has worked in PPH case. Oh, okay. Then he supplied information of 3 cases he had done by using condom and IV set. So I had collected some 10-15 cases by the
Next ICOG.
1985 ICOG, where I presented. There, one of the person from audience called me. It is something like O'Sullivan. Exactly, you are right, boy. It is like something like O'Sullivan. Only condom membrane has been placed between tissue and fluid.
Excellent, very good. Very good thinking, and then of course it still took some time for it to get published and to come into the open, but today we are so glad that I think all the international bodies have recognized the hydrostatic pressure balloon tamponade is the first line of treatment of PPH. Right, sir? So it must be making you very proud that your idea has gone world over.
Now I feel proud.
Yes.
That time, no.
But great. So we feel proud for you. We feel proud that you've been there doing this for us. And I still remember the one direct relay which you had done from the AFG years back. I've got some clips from there which I will show to the people to explain how this is done.
Uterus is become full, you will see the uterine contour, you can palpate the uterine contour. That time you are clear about certain that uterine dead spaces are filled. Right? And once dead spaces are filled up, the pressure starts developing. Remember that we are not giving pressure. Pressure is being developed inside. You allow the pressure to develop inside.
And then you lower the bottom.
Once the pressure starts developing inside, the flow starts reducing. If it does not reduce, means there is so much hypotonia, you have to bring it down. So many times I have used as much as only 16 centimeters above symphysis PPH. Yes, chilled saline, very good. You will read the references using chilled fluid for hemostasis in bladder cancer. Then you apply micro balloons through cystoscope and use chilled saline to achieve hemostasis. That is good. Vessel will be constricted and hemostasis will be achieved. But again, the same question. Can you get chilled saline immediately when you want it, when you need it? Answer is no. Even we don't get chilled beer when we want it.
Personal life and all, your medical degree was from Bombay, from JJ Hospital, and you've always been
Everything in Grand Medical College.
Great. So you're a Grand Medical College product, and
From first MBS to final MBS, post graduation, and lecturer, reader, everything in Grand Medical College.
Hi everybody. Dr. Shivkar sir was my teacher at Grand Medical College and Sir J.J. Group of Hospital, Mumbai, from whom I learned practical approach in management of obstetric and gynecological cases. He's simple, soft-spoken and down-to-earth person. He believes in Japanese proverb. If you can do, I can do. If no one can do, then I must do. With these aims in mind, he developed an unique technique for management of atonic postpartum hemorrhage by hydrostatic pressure called Dr. Shivkar's bag. Of course, we saved many mothers and many utera. His work has been recognized all over the world and it has been cited in textbook of obstetric, Holland and Broom.
when you mentioned Dr. Palep, I think he was the first to use it for inversion of the uterus. That was that was another indication, because we had cancer cervix bleeding, random bleeding, postpartum hemorrhage, and then inversion of the uterus came. How did that?
During first conference, this 29th Congress, All India, I had mentioned other uses. And even Dr. Palep was one of our gang. He knew it can be used for inversion of uterus. But he got first chance to do it. Dr. Palep and Dr. S.K. Patil. I collected information from them. They had used 1000 ml of fluid at 100 centimeters of water. Within 5 minutes, inversion got corrected. They did not use any sedatives or anesthesia.
Oh, that's a very big thing, because if you want to manually do it, you need to have some sort of a relaxation or anesthesia. So today we also have with us Mrs. Shivkar, and we've got Dr. Suvarna Khadilkar here. So first over to Dr. Mrs. Shivkar, who to give her comments on what she feels about this whole gamut which her husband has originated and brought to the world.
Actually, he has originated when I was in JJ for my first child delivery.
Yes.
And that time he has originated this invention.
Used first time this invention, yes.
But after that, as it is, he used to work on his own. He was not interested in showing anyone. But Dr. Suvarna Khadilkar was associate professor with them. She has every time pushed him to do the presentation and do publication for this. Even that whatever he has done invention, she has made efforts to put it in proper way and to publish in the journals. That time.
That's great. So here we have Dr. Suvarna Khadilkar with us, the Deputy Director General of Foxy, and she has worked in Jogis for many years as an editor. She is so much into paper writing and scrutinizing all that matter that she has brought out so many papers on Shivkar's pack. Most importantly here, she is the one who has worked with Sir for a very long time as Associate Professor in the JJ Hospital. So Suvarna, over to you, and give us your inputs on this. And we wanted to ask about Sir's journey and publications, etc. What have happened after his invention.
Yeah, thank you so much, Dr. Uday. It's very humbling introduction that you have given. But it was my pleasure to work with Sir as associate professor. And I remember his OTs used to be full. The longest list of OT used to be Sir's, and we really had lovely time. We used to really assist Sir. We used to see his surgeries, and we thoroughly enjoyed. But most important was, he was using this invention which we call as Shivkar balloon, but basically it's a pressure balloon which he has invented many years ago. He has been using, he has saved so many women. But when I started working with him, you know, I felt sir is not represented in the national or international scenario. And what I remember, I don't know whether sir has mentioned it before, he had attempted a publication on this balloon earlier, but it was rejected. And then I think he didn't want to do it again, but I said, sir, no, this is a brilliant invention, nobody has done it before, and this is something which is effective, saving lives of mothers, so you have to give it to others so that so many other doctors can use it and so many millions of women can save lives. So then I put it, the whole experiment which he had done many years before. So with my colleague Dr. Manisha, we both sat together and we actually performed the, the experiments with the column, water column, and the space which we created as a uterus, and then we put that thing in and we actually measured the pressure at different heights. And then we finally proved, and we had a graph which has been published in the our article. And there were so many positives about this balloon which we now practice. We use it as also device which we can introduce. It doesn't require skill. Anybody with a minimal skill can introduce and just transfer the patient to a higher center. So even if you have a patient in your setup where there is nobody to help you, at least with this skill you can put the balloon and you can transfer and you can really save. Sir, I am really grateful that I got an opportunity to work with you. I feel very proud that our own JJ hospital doctor has invented such a thing for first time, and it was published also, luckily, first time in the world.
Khadilkar asked me in 1998, why you are not publishing it? I tried to publish it, but my article came back. First it came back for reduction in size. It is oversized, can't be printed. Next time it came back as a rash article.
And 1998,
so I kept it aside.
Sir, that was the year when I first joined Jogi as first assistant secretary or joint assistant secretary. So that time I used to feel, why not publish it? And after that we have seen so many other types of modifications of this device have come up, but nothing like the original.
So what do you say about the modifications? Are you happy or?
I am happy because my aim was to spread this method everywhere.
So that's good. So that is probably the reason you didn't even want it patented in your name.
Yes, I wanted to patent it, but I thought if I patent, I will have to give specification for everything what I am going to patent. And when I give specification, my contraption is bounded by all those specifications. And since this is not something required frequently, the manufacturer will be manufacturing in small in amount. And cost will go manifold high. Say condom which is available in 1 rupee. Now that condom itself will be available in 1000 rupee.
Very true, sir.
So that's a great thought, sir, of not patenting it and leaving it so simple. That let me give you a little input here, sir. We from Foxy are doing the Manyata program, where we are upscaling the skills of the paramedical workers of all nursing homes, including the small private nursing homes all around the country. And this is one of the things which we teach them, how to make a condom catheter. And it is there in that PPH kit. So this is how much it is spread today. You will be happy to know it is spread to every corner of India. It is spread probably to every corner of the world. So that was Dr. Shivkar for you, a very humble, unassuming, but a genius personality who thought of and refined the hydrostatic balloon pressure for PPH. I hope you have enjoyed this series, Diamonds Are Forever, where we have attempted to bring you stories of our stalwarts like Dr. Shirorkar, Dr. Patwardhan, and Dr. B.N. Purandare earlier. And today we've got you the story of Dr. Shivkar. This is a humble attempt by the Indian College of Obstetrics and Gynecologists to bring forth in the forefront these stories and these stalwarts so that our generations and the next generation can learn from the enthusiasm and get inspired by them. We have many more inventions happening, especially in the field of PPH and endoscopy, which we hope to bring to you very soon in the future. I take this opportunity to thank all my colleagues who have helped me to bring this series together. And in the backend team, Namita Thapar and her team, led by Hitendra, to bring this on the screen. So thank you for watching, and I hope to see you soon. I, Dr. Udit Hanawala, Chairman ICOG 2122, am hereby signing off. Thank you.